name's Zoe Irons. I'm from Wellbeing of Women. For those of you who haven't joined us on a webinar before, this was a series of 5 webinars. This is the last one. And today we are going to talk about people that work in non-office-based roles and how the menopause might affect them. So I'm going to hand you over to my colleague, Liz Cunningham, and she's going to talk to you a little bit more about today's all about. Thanks, Liz.
Hi, everybody. I'm Liz Cunningham, and my organisation is Menopause Reality. We share women's own experiences of the menopause through immersive film, and we've been working with Wellbeing of Women for 3 years now to deliver in-person sessions in workplaces designed to engage and raise awareness of menopause and menopause support for workplaces. And I've been working on that project with Diane Danzebrink. So I'm going to ask Diane to introduce herself now.
Hi, everybody. I'm Diane Danzebrink. I'm the founder of Menopause Support, which is a community interest company providing education, information, guidance and support to individuals, but also to businesses and organisations. And I'm also the founder of the National Make Menopause Matter campaign and author of Making Menopause Matter.
Fantastic. Thanks, Diane. And joining us on today's webinar are 2 people who've been to one of the sessions that we've been delivering with Wellbeing of Women in workplaces. And so this is Joy and Nicola. Would you like to introduce yourselves and tell us where you're from?
Yeah, hi, morning everybody. So we're from the Forest of Marston Vale Trust. So we're a charity, an environmental charity that plant trees, but we're very diverse organisation. So we've got offices where myself and Nicola sometimes works. So I'm in the marketing department as a marketing assistant, and then
I'm the senior ranger, so I'm out and about on nature reserves and community woodlands most of the time. I'm not in the office all that much, especially through the winter. So yeah.
That's great. Thank you both for introducing yourselves. We're going to come back to you to talk a little bit more about the menopause support that your workforce needs. But first, just in case people haven't been with us on the other webinars in this series, or in case anyone is new to this, I think it's good to always start with a few of the kind of the basics. So Diane, you mentioned that your book is called Making Menopause Matter, sorry. Would you like to start by telling us why menopause matters?
Yes, certainly. So it matters because it's something that around half of the world's population are going to experience directly. So the world population is currently just in excess of around 8 billion people. So around half of those will experience menopause directly, but the other half will know somebody who experiences menopause. So it's really important that they understand it too, so that they can support. So that's the first thing. We know that greater understanding of menopause allows people to make more informed decisions about how they manage their menopause transition, whatever that might look like for them. We also know that we have more women in the workplace over the age of 50 than we ever have historically. We also have a huge number of women under the age of 50 in the workplace. So we're going to have those who are perimenopausal and postmenopausal. So it's really important that all business owners, managers, employers understand something about menopause so that they can offer support where and when that's required. And ultimately, the more that we all know about it, the kinder, more compassionate and more supportive we can be to each other.
Absolutely. So let's start then with another basic question then of what is it? What is the menopause?
So it can be quite confusing because menopause can be quite diverse in its experience. So I think the first thing to say is we use the word menopause to cover a transition for many of some years, but menopause also has its own clinical diagnosis. So I think we would probably be better to have an umbrella term of the menopause transition. And in terms of the clinical diagnosis of menopause, that represents when somebody has had at least 12 continuous months without a period, which for many comes around the time of their perhaps 50th year, 51, 52, etc. Can be a little bit earlier, can be a little bit later. So if we start with what the majority will experience, which is called generally either a natural or a spontaneous menopause. This is where somebody experiences perimenopause. So peri means around the time of. For many, that begins in their late 30s, early 40s. Not everybody will have symptoms. Around 3 out of 4 have symptoms. And those symptoms begin because the hormones that fluctuate on a monthly basis start to become more erratic. So they're changing more regularly and sometimes more significantly. And that's what then can precipitate symptoms for about 3 out of 4. So that perimenopause can last for some years until you reach menopause, which is where somebody has had 12 continuous months without a period. And everything after that is called postmenopause. On average, from the beginning of perimenopause to menopause is around 4 to 8 years. Then we have other types of menopause. So somebody might experience a surgical menopause. This is where both their ovaries are removed at the same time. That's called a bilateral oophorectomy. And that puts somebody into an immediate menopause. Other people might have what is usually termed a medical or medically induced menopause. That's where somebody's having medical treatment that affects the function of their ovaries, and that in turn can bring on menopause symptoms. There are those who might experience an early menopause, which is menopause between the ages of 40 and 45. And there are also those who might experience a premature menopause. So that's menopause under the age of 40. So currently in the UK, approximately 1 in 100 under 40, 1 in 1,000 under 30, and 1 in 10,000 under 20 will experience a premature menopause.
That's great, thank you. And you mentioned about the different times that that women can start experiencing symptoms, but I think it's also really useful to do a sort of broad overview of what the symptoms can be.
Yeah, so broadly, symptoms really fall into 3 categories. So they're physical, cognitive, and psychological. So physical symptoms, I'm sure everybody's heard of hot flushes and night sweats and are aware that eventually periods stop. But again, those physical symptoms can be quite diverse. So some people might experience things like dry eyes, dry mouth, burning tongue, perhaps changes to their hair. They might experience heart palpitations, achy joints and muscles, itchy skin. So those kinds of things. There's also a sort of subset of physical symptoms, which doctors refer to as the genitourinary symptoms of menopause. So these are things like increased urinary frequency, urgency, perhaps increased urinary tract infections, and vulval and vaginal symptoms. And then with the cognitive symptoms, you'll often hear them called brain fog. And what we're really talking about here are changes to memory and concentration. And then the psychological symptoms, again, they can be quite wide ranging. Probably the one that we hear on a daily basis at menopause support is about increased levels of anxiety. So anxiety, low mood, mood fluctuation, perhaps even changes to levels of confidence. So that's a very kind of broad overview. There are more, but that kind of gives an idea.
I'm just going to share, I was in a meeting this morning, and just one of the most common phrases that we've heard in many of the sessions we've done together is, I felt like I was going mad. And I had that again this morning. So I know that you hear that a lot, don't you?
Yeah, I think some of the most common phrases that we hear at menopause support and have done over the last decade are things like, I feel like I'm going mad. I don't know who I am anymore. I don't recognize myself. This is having an effect on me at work. This is having an effect on my relationship. And I think just those phrases show us just how many people have come to this part of their life without the right information about menopause. And I think that's why things like initiatives like this are so important, because the more opportunity we have to share that information, the more informed people will be. And hopefully we'll see a time when fewer people are feeling like that.
And this is the opportunity, isn't it? Is sharing this information in the workplace, because it often hasn't been shared with people up to this point. So that sort of brings it on really nicely. So thank you very much for giving us that introduction. For anybody who would like more information like that, if you go back to webinar number 1 in the series, we spent the whole hour kind of talking in more depth about symptoms and the different impact on people and the different stages and types of menopause. So please do to check back. Zoe will share the links to watch the webinar afterwards. So I'm going to come to talk to Nicola first. Nicola, we met you in one of our sessions, and you were talking to us about the different elements of your job. And it's not an office-based role. Would it be okay for you to explain to us what a typical day might look like for you, or what a typical week might look like, if that is a variety of different things?
Yeah, I mean, there's not really a typical week in my role, but I'm often out on site from 9 until 3:30, 4 o'clock. Yeah, limited access to facilities. I mean, I was on an island in the middle of a lake a few weeks ago. So yeah, it's very active. Yeah, very, very physically demanding. So yeah, I could be out tree felling, I could be out brush cutting, I could be out doing site checks, walking for miles in the day, and yeah, it's very, very active role.
Okay, and what are the things that you have, what challenges have you either already experienced, or do you anticipate maybe a challenge for you if you're experiencing the menopause symptoms that Diane has talked about?
Yeah, I think probably for me the biggest concern is things like fatigue and the brain fog, because particularly when I'm out with power tools, it's very, very physically demanding, and if I've struggled to sleep overnight, or I'm just waking up feeling really achy and exhausted, it is difficult to then go out and be tree felling or be brush cutting or hedge trimming. So yeah, and particularly with tree felling, you have to be alert and with it and make sure that you're not about to fell a tree on a member of the public. And so yeah, like the brain fog, I think is a concern as well for me. So
and what about the kind of environments that you work in, and sort of how that affects your access to facilities and things like that? Is that something that you considered?
Yeah, I frequently I mean, we work in woodlands, so you know there's always a tree that you can go and hide behind, but it's not ideal. Some of our woodlands are only a few years old, so there's not it's sort of quite an open space, and there's not that many places that you can go and hide. So yeah, that's always something that's on our mind, and we're always thinking, oh well, we need to make sure we go what we call a safety wee before we go. And yeah, sometimes you will go the whole day and you'll be like, okay, I'm just going to run to the loo as soon as I get back to the office. But yeah, it is difficult because, like I said, I was on an island in the middle of a lake the other day. So even if we were to start trying to bring in a welfare unit or something, it wouldn't always be possible. So yeah, it's definitely something that I think about a lot.
So Joy, thinking, Nicola's shared with us the kind of challenges that she might face in her role, but the breadth of different non-office based roles that you have at Marston Vale span a number of different areas, don't they? Do you want to just give us a quick overview of what they are so that we can think about different work environments?
Yeah, so in terms of out of office roles, we've also got a cafe, which is in our main forest hub. So we've obviously got our catering staff down there, and we have had a couple of ladies who have been experienced in perimenopause and menopause. So it's just sort of balancing, well, mostly for us, because both me and Nicola are mental health first aiders as well. So a lot of it is sort of, I don't know if I've jumped onto the next point or not, but a lot of it is just making sure we have open conversations with people and that we are sharing information.
Yeah. So what I think would be useful is to talk about a little bit about the challenges that you face as an organisation when you've got employees who are on an island in the middle of a lake doing tree felling, or working in the as catering staff, for instance. What are the kind of challenges that you have encountered in terms of getting support to them?
Yeah, so a lot of it is our catering staff don't have access to emails and computers, so personal emails, whereas within the office, both me and Nicola have emails, and all of our colleagues upstairs have emails, whereas our colleagues downstairs don't necessarily have access to personal organisation emails. So that's definitely getting information in terms of digitally is quite hard. Yeah, so that's probably our biggest barrier in terms of communicating stuff like menopause and anything mental health related.
And so what have you done to overcome that, into the sort of communication barrier of, because with office-based roles, obviously you can share information very easily via group email or intranet or something like that. But what things have you done?
So we sort of have, at least I think it's about 5 touch points where we make sure that we put posters out. And in terms of, because I think a lot of people think of menopause and they think, oh, it's the woman's problem, but we try and, I like any in terms of digitally, I have shared emails to everyone within the organisation that I can. And similarly, for whenever we're sharing posters at these touch points, it will be in the men's toilets, it will be in the women's toilets, and we have these touch points. We also communicate quite a lot with the general manager downstairs. So I do prompt her quite a lot to try and, because they have their own work WhatsApp. So I do try and prompt them to put it into the group chat to share like amongst the team downstairs as well. Can you think of any other bits that we use? Those are the most, they're the main sort of touch points that we sort of try and communicate stuff like this to the catering staff.
That's great to hear. I'm going to come ask Diane in a second about other industries that we might not have covered, but I just was thinking that anyone who's joined the webinar who is from an industry that we might not have mentioned yet, or has a workforce that are doing a role that you'd like that you're thinking of in particular, if you want to pop a question in the chat, then we can make sure that we try and cover that off when we're talking about things. It'd be interesting to know which industries you're coming from. But Diane, you've worked with many women over the last 10 years or so to support them with workplace and non-workplace challenges to do with the menopause. I thought it might be quite helpful to sort of span a few of the other non-office based industries. What have you come what challenges have you come into contact with?
So a lot of them have been in healthcare roles. So that might be nurses, it might be healthcare assistants, it might be carers. So in lots of healthcare roles, I think there's two sort of main challenges. One are that for many of them, they find themselves on their feet most of the day. So if you're struggling with physical fatigue, if you're struggling with achy joints and muscles, and if you're struggling with hot flushes, if your uniform isn't optimized, if it isn't a good technical fabric or whatever might work the best, if you have no opportunities for resting, if you're having to physically move patients and you are struggling, with your joints and muscles. Similarly, for those who work in factories, often lots of time on their feet, standing still, not a lot of movement going on. That can also be quite difficult. Cabin crew. So cabin crew who they're in a very restricted space with a lot of other people in a uniform very often, often having to serve hot food. That can be very tricky. Construction. So, wonderfully, we're seeing more women getting involved in construction now. But on construction sites, it's not to say all, but on many construction sites, toilet facilities are only there for, well, they're called unisex, but basically they're used by men. So there aren't separate male and female toilets. So that can be very difficult if you're experiencing perhaps very heavy or erratic periods, if you're experiencing those increased urinary tract infections, etc. For those who have to wear protective equipment for their work, so perhaps you work in one of the emergency services and you have to wear protective equipment, has that protective equipment been optimized for you? So that's a few of the things that I could think of.
Somebody's just added to the chat that they work for London Underground in a station environment, which I can imagine can present some of its own challenges as well.
Yeah, very busy. In the summer can be incredibly hot. A lot going on, probably a lot of people wanting information from you, can be quite an overwhelm. I mean, as somebody who probably most of us have done some travel on the London Underground, but, it can be packed. It can feel very overwhelming as an environment. Yeah.
So I think that, so we've kind of covered a number of different working roles and a number of different environments. It'd be good if we can focus a little bit on what strategies can be put in place to help. So if I come back to you first, Nicola, you talked about the challenges that you face, such as one of them being lack of access to toilet facilities, for example, and another one being fatigue. What do you do individually in order to help mitigate the challenges, or what will you do when you're kind of anticipating these?
I think the things, especially with fatigue, that's a symptom of so many different things that I'm very fortunate that we've already got things in place to help with that. I'm lucky that I work as part of a team of 5. So if one of us comes in one day and is like, I feel really ill today, or I didn't sleep well last night, then there's always other members of the team who can step up and help out. And we're a very open team as well. There's a lot of communication between us. We're very supportive of each other. So none of us feel bad about coming in and saying, guys, I'd prefer it if somebody else did the chainsawing today. I will help clear up. I will do everything else, but like I'm not feeling great. So I think, and it's already in all of our risk assessments, if you're feeling fatigued or if you're on medication that's making you feel fatigued, to take it easy. Our manager, I'm very fortunate that our manager is she's happy that we're taking plenty of breaks and making sure that we're taking plenty of breaks, because obviously what we do is already very physically demanding. It is a case of we'll stop when we need to stop, and we'll have 15-20 minutes, have a drink, have a snack, then crack on again. I think with regards to the toilet facilities, I'm not sure how we can change that, just because of the nature of where we're working most of the time. So that's maybe a conversation that needs to be had with management at some point.
But similarly, jumping onto that, I think the flexibility within your ranger team anyway allows, you know, if they're out on site and you're coming back and you're like, oh, I need to pop to a service station before coming back, there's always that flexibility within your team and that understanding. Yeah,
definitely. And you know, I think as was mentioned earlier, like just open communication within the team so that everybody knows how everyone's feeling, and we all know what the other one is going through, be it a home situation or a health situation. We all feel very comfortable, and I'm aware, I'm very fortunate, not every team has that relationship with their colleagues that they can come in and say, guys, I'm perimenopausal, I'm feeling a bit rubbish today, can somebody help me out? And I'm aware a lot of people aren't necessarily going to feel comfortable saying that to their team members, and you know, I'm a mixed sex team. We've got men and women in the team. We've got a mix of ages in the team, and everybody's just very understanding and willing to talk to each other. So I think, trying to build that relationship within your team is really important, to be able to have those conversations and that understanding from your colleagues.
Yeah, and and I guess that communication and the taking a supportive approach is just, you know, the most valuable thing there for you. Joy, what do you do as an organisation in order to help individuals who might be facing different challenges to Nicola?
A lot of it, like similarly, like what Nicola said, a lot of it is I think flexibility. So we obviously have open conversations with our managers, and I know the general manager in our catering department is extremely flexible, but also it is that open conversation, and I think the more we talk about it, the more it will come up in conversation, which then allows people. And I think as long as because as mental health first aiders, we're more than happy to talk about anything with most people, and I think starting those conversations and making sure that it is spoken about is something that we like try and implement a lot anyway, if anyone ever comes to us about something like this.
Diane, from your, again, wealth of experience of working with people in all different kinds of industries, does this sound familiar? Is this what other industries are doing? And can you share any good examples of other ways that people have put support in place?
Yes, but I think first of all, I mean, let's just recognise how fabulous it is to have such a wonderful culture to work within, because ultimately that's what underpins everything. If you have a supportive workplace culture, a genuinely supportive workplace culture, that's what underpins everything. I mean, you know, kind of listening to the support within the teams, that is, and I appreciate, you know, as you say, it's a small team, but that's really the way forward, is starting your building blocks being supportive workplace culture, information and education for everybody, and then giving people a sort of a guideline in terms of what they should be able to expect when it comes to seeking or giving support and what part you play in that. So I think, you know, some of the really common things that crop up are adaptation of uniform. So where it might be, so going back to the cabin crew, one of the things that one of the women that I worked with had requested is the uniform was quite complex. There were two or three layers to it, and they had to wear a neck scarf and a waistcoat and a jacket. So one of the things that she asked was, could she dispense with one or two of the layers, so that she was still in the same colours and the same basic uniform as everybody else, but could she dispense with some of the layers? And I have to say, there have been, over the last few years, there have been varying responses to that depending on the airline. So some very supportive, others unfortunately less so. But hopefully, hopefully things have changed now. But I think with any uniform, as I say, I've worked with lots of people in healthcare who one of the big problems for them is if they're experiencing an awful lot of hot flushes, they're worrying about the fact that they're actually sweating through their uniform, and then they're doing personal care with patients. They're having to lean over patients, having to work very closely with patients. So they're very aware of their uniform and the fact that, they've been very hot and sweaty and they're uncomfortable and they're worrying about that. So actually just providing more sets of uniforms so that people can change on a regular basis can be really helpful. With those who are wearing any kind of protective uniform, obviously it has to remain safe, but it's about optimizing that. Is there anything that you can do to change it for them? Toilet facilities is really common. And certainly it's interesting actually, I spoke to somebody very recently who's been working on construction sites for a few years and has had this issue where all the toilets are essentially, they're called unisex, but really it's just men that use them. But she'd gone onto a construction site recently where there were separate male and female toilets, and that made her very happy. So again, hopefully that's something that we're going to see happen more regularly. I think, the other things that very often come up are perhaps whether it's physical fatigue or whether it's cognitive fatigue, whether somebody is feeling, cognitively tired. It's that opportunity to have a break and actually pre-agreeing that those breaks can happen. They can be so helpful. If somebody has to stand in one place for long periods of time, so this could perhaps be in a factory setting, is it safe for everybody? Is it safe for some individuals to sit for periods of time rather than having to stand all the time? I think all of those things can be really useful. If you're sedentary, so if you're in a place where you are sitting all the time, is there the option to get up and move around and, have 5 minutes to yourself? If you are working in a situation where you are perhaps struggling, I'm just thinking of one particular person that I worked with a couple of years ago, and one of her duties as a healthcare professional was to essentially give out medication on the ward. And she was having a whole host of symptoms, but the one that was really affecting her was her cognition, the cognitive fatigue. And so there was an agreement, once she had spoken to her manager about that, there was an agreement that actually she wouldn't do that for a period of time. Somebody else would take over that duty. So I think it is really important to say that once anybody has disclosed, a risk assessment should be done, whatever. So a risk assessment can be very simple, but a risk assessment should be undertaken. And then it's about thinking about what can we do in terms of reasonable adjustments to help this individual. And as we've heard, sometimes it means actually not undertaking all parts of your role on a particular day or in a particular time frame.
I'd written down risk assessments actually to come back to, and I think that this it might be quite a helpful thing to if people don't have risk assessments in place for individual roles, and they want to consider the impact of menopause, are there any good places to start if they need to put that into place, could you give them some signposts?
Yeah, absolutely. So I think one of the most comprehensive pieces of guidance that we have is from the British Standards Institute, and that is the menstruation and menopause guidance. So that's a fabulous document, and you'll get lots of information from there. We do also have information from the CIPD, Chartered Institute of Personnel and Development. So they have a menopause hub on their website. ACAS have some very useful information, and the Faculty of Occupational Health also have, it's a very basic document, but good signposting. But I think for something that is very comprehensive, I would probably say put some time aside and read the British Standards Institute guidance, because it is a really good piece of guidance.
And that's free to access, isn't
Yes.
it, that guidance?
Yeah, absolutely. If you just go to the BSI website, look up menstrual health and menopause, or even just put one of those words in, the guidance will come up for you. Yeah.
Oh, somebody has very kindly popped it in the chat. So
perfect.
That's fantastic. Thank you very much, Kitty. So yeah, the link's there. I'm sure that Zoe will share the link afterwards when she follows up with the webinar as well. So that's great. So that's where to start if you're going to put a risk assessment plan in place. So I think that we've covered the different challenges that might face. I mean, it's almost how long's a piece of string to ask what different challenges might face people in non-office based roles, because you could go on forever and a day describing all of the different non-office based roles that people might have. And just because one person does the same role as another person and they're both experiencing menopause doesn't mean that they will both be impacted in the same way, because there's so many other variables. But we have covered quite a few in this call. We've covered quite a few suggestions of strategies that can be put into place. One that I've just noticed in the chat that we haven't explicitly covered, that it might be good to just touch on, is people working in higher education and further education, frontline employees. So that might be library assistants, faculty staff, catering staff, security staff, grounds technicians. Kitty, who's asked that question, has said it's interesting to hear about the value of creating and adapting communication channels to support frontline staff effectively. So that's great. Thanks for sharing that, Joy. But any other experiences on those sort of roles? I guess they kind of overlap with quite a few of the others that we've touched on, Diane, but did that bring any librarians? Any librarians who supported directly?
I think we also have to remember that there are some situations where, particularly, I'm thinking of, I live in quite a rural part of the country, and quite a lot of the libraries here have very few staff. So, and it sort of puts me in mind of when I work with teachers who obviously are generally on their feet a lot. They're usually in the classroom on their own unless they have a teaching assistant in with them. And that can present very specific challenges in terms of, well, can I leave the space because it is otherwise unattended? So I think that, I've worked with a lot of teachers, and just having sort of with the book, I did a bit of a local kind of library tour last year. And a lot of the libraries that I went into only had 1 or 2 staff. So actually, that's quite a tricky situation in terms of what do I do if perhaps I need to use the loo very regularly? Or what do I do if there are other symptoms that are impacting me and I need to take a break? So again, I think keeping those lines of communication open in terms of speaking with whoever the line manager is and seeing what can be put in place. Because obviously, as you rightly say, Liz, no two No two experiences are the same. So it is and no two roles. We can't compare the roles either, because they bring their own individual challenges. So it is very much about what can be done for each individual within their symptoms, whatever it is they're experiencing. And, you know, for some people, they do have within their role, the timings of their role are very set. So it's about thinking about, well, how can we best support them as they continue in their role? So I think it does very much come down to individual conversations. I mean, one of the things that I often say to people, so I speak to a lot of people still, unfortunately, who are thinking that their only option is either to reduce their role or to leave altogether. And so I end up having quite a lot of conversations with people who say, you know, I think that is my choice. And so my first question to them is always, what is it that's having the greatest impact on you, that's making you think this way? And once they've explained that, I will then say to them, okay, so if you could choose within your role, what would help you the most? And it's really interesting because when you ask that open question, people actually often haven't thought that that could be a possibility. So asking that open question can sometimes be a real light bulb. So then when I train managers, I will say to them, when somebody comes to disclose to you, to have that first conversation, rather than telling them what you can do for them, ask them what would work for you. Because everybody is going to give you different answers, because you could have two people working in the same organization doing the same role who are going to be experiencing their symptoms differently and would request potentially different adjustments. So it's really important that we always keep an open mind.
And I think that it comes back to why it's so important to share this information in the workplace, because people coming into the menopause may have very little information about it, but this is an opportunity to get it out to everybody. I'm just thinking, and this is a question that can go to Joy and Nicola as well, in terms of the variety of different roles. There's obviously the communication challenges of non-email based roles is one hurdle that we've had a suggestion of how to overcome. But there's also in diverse workforces sometimes other aspects to consider, such as whether people are, if they're not in an office-based role, then the written form of communication might not be the best way of engaging with them to share the information. And we have certainly heard examples of successful groups that people have initiated, and just an opportunity to chat and share experiences. I wondered if you'd if you've done anything like that at Marston Vale, or whether Diane's got any good experiences of that to share as well.
We haven't actively yet, have we? As mental health first aiders, obviously we've got a lot to cover in terms of mental health, menopause obviously being an important one, but I think it's something we would like to do in terms of workshops in general for mental health, but it's not something that we've actively covered of yet, is it? No.
If an organisation hasn't instigated some kind of opportunity to talk amongst peers, have you got any tips, Diane, on how to get that started?
Yeah, absolutely. I mean, you know, brilliantly, Joy and Nicola have talked about, you know, kind of having posters and, you know, having touch points for information for people. I think really the best way to do it, it's very simple. It's you choose a time, you choose a location. For a lot of people, that location is, sort of it's within a building somewhere at a particular time. And one person or two people might choose to host it. But just to say, kind of, we're going to have a menopause support group. This is going to be the first one. Please do come along. For other organisations, some of them actually do those things in this sort of forum. They'll do them online just so that they can bring in those who perhaps work remotely or perhaps do hybrid work or whatever. But I think it is just about saying, okay, we're going to do it. We're going to have, and very often it's not unusual. I was talking to somebody the other day and they had started one in their workplace probably about 18 months ago. And she said at the first one, there were 3 of us. She said, now we regularly have 40 people. It's a relatively big organization, but we now regularly have 40 people. We have men and women come to the sessions to, sort of get some information, to talk about what's worked for them, just to have a chat about it. And what it's really helping to do within the organization is they have done some formal training, but it's helping to keep the conversation going. And it's really helping to normalize the conversation because people go away from the group meeting and they'll talk to their colleagues back at their desks or wherever it is that they might be, sort of in the factory or whatever. They'll talk to their colleagues about what they've been talking about at the menopause meeting. Similarly, there are some organizations who, in a similar sort of role, sometimes formally, sometimes, less formally, they have a sort of first point of contact within the organization. So some people call them menopause mentors, some people call them menopause advocates. For some, it's just somebody within the organization who has approached either, sort of the owner of the business, if it's a smaller business, or the HR department, and said that they would volunteer to be the first point of call for menopause, really just to listen and then to signpost people. So all of those things, I think, really help to not just keep the conversation going, but to make it a normal part of the workplace conversation, to make people feel comfortable to talk about it.
Okay, I've got a couple of questions that have come in, but just to say for any of our attendees, if you want to ask anything that we haven't covered yet, then please feel free to pop a question in the chat and we'll try and get to it. We've got about 10 minutes left. So we've talked a little bit about uniform, but one question in particular was asking about whether, is it reasonable to ask to wear your own clothes if an alternative uniform isn't available? And I guess that the word reasonable is quite interesting because there is a phrase, isn't there?
Yeah, absolutely. So I think, is it reasonable to ask? Well, if there is no alternative uniform available, I guess part of it is going to depend on what's the role. What does the normal uniform look like? Do you have something within your own wardrobe that looks similar? But I mean, I think if you've said that the uniform is an issue in terms of exacerbating your symptoms, so I think it is worth pointing out again, I know we've done it in a couple of the other sessions, but I think it is worth pointing out again that employers do have sort of legal duties, particularly, sort of, we know the 2010 Equality Act and also the 1974 Health and Safety at Work Act. So if somebody has disclosed to you that they are experiencing certain symptoms and their uniform is having a detrimental effect on that, it is up to the employer to try to ensure that they are doing everything to ensure that what the employee is being asked to do, what they're being asked to wear, etc., is not having that detrimental effect. So the first thing I would say is it is really the responsibility of the employer to try to provide something which means that it's not having a detrimental impact. If you have requested that and they've either refused or they've said it just simply isn't a possibility, then I think another conversation does have to be had around, actually, this is the biggest impact for me, so we need to find a way around it. And is a way around it me wearing something of my own? Now, depending on the role, of course, that may or may not be possible. And as you say, reasonable it's an interesting word, isn't it?
Yeah, definitely. Okay. And a question about risk assessments, again, going back to risk assessments for a start. As a small business, what should be in a risk assessment?
So risk assessments can be pretty simple, and they should certainly cover things like, does this person have reasonable access to toilet facilities, to drinking water? Can we look at the temperature that this person is expected to work in, etc.? So they're kind of the very basic things. But risk assessments will obviously be dependent on each individual role and what the individual is being tasked with.
It might be helpful to ask Joy about that, because you mentioned that you do have a risk assessment, Nicola. Is it something that is in place for everybody in all different roles within Marston Vale?
So each department is responsible for their own risk assessment. So our risk assessment doesn't mention menopause specifically, but a lot of the symptoms for menopause are covered within the risk assessment, just like predominantly sort of the fatigue side of things, just to cover us on if you are feeling tired, obviously you shouldn't be using the power tools that we use, and whether we do need to look at making sure that we have menopause covered in our risk assessments is something we maybe need to discuss. But yeah, we're working on our staff stress risk assessment at the moment as well.
Yeah.
And I don't know whether it's something that would potentially comes under there. But yeah, we have extensive risk assessments for absolutely.
Imagine when tree felling is part of your job role, I imagine you have to have quite significant ones. There was one question, this is quite broad, Diane, but it might be an opportunity to share just a couple of examples from your many anecdotes from previous support that you've put in place for women. This person says they can't work from home in their role. So what ideas can I suggest as practical solutions to manage symptoms? I mean, that they don't say what they're doing, so it could be any type of role, but are there where would you start?
Yeah, so I think obviously we don't know what the specific role is, but I think the first port of call is to have that conversation. Is to have that conversation ideally with your line manager, but if you don't feel that they're the right person, you can of course ask to speak to somebody else. And actually, if you do approach your line manager for a meeting and they don't feel that they're the right person, they can, of course, arrange for you to have that meeting with somebody else. Then it is to have that discussion about symptoms, the impact that they're having, how you feel that you can best be helped. And then in terms of looking at the role that you have, what the organisation can do. So I think, some of the most important things are A, that you have an active listener, B, that the conversation is ongoing and that any adjustments that are made for you are reviewed on a regular basis. And then we need to think about, okay, so you absolutely can't work from home. So if you can't work from home, if you are somebody who feels that they would benefit from having more regular breaks, then can that be implemented? So can that be agreed so that you can take those regular breaks as and when you need them? is there a space put aside for you to be able to take those? Can you leave the workspace, whatever that might be, to be able to do that? So one that just pops into my head is a lady that I spoke to very recently who works in a factory environment. She's not actually on the production line, but she is in a factory environment. She has a supervisory role. And she can't do her job from home, but she has quite significant hot flushes. But within the building, which is vast, that she works in, there is a particular part of it that is much cooler than the rest of it. So one of her agreements with her line manager is that when she has a particularly bad hot flush, whatever she's doing, she can take herself off quietly to that space. She can spend some time there to cool down, and then she can come back and carry on. Really simple, but hugely effective. If somebody can't work from home, if they're struggling perhaps with concentration, is there a quieter space for them to be able to work? Again, that's really important. Obviously, if it's somebody who they might want to work from home because they are experiencing those genitourinary symptoms that we talked about, do they have close access to toilet facilities? That's really important. Do they have access to lockers where they can leave clothing? They can leave, sort of the things that they need, whatever that might be. If perhaps they do have an incident of flooding or they do need to run to the toilet quickly, are they close to the toilet? Has it been made? Has an adjustment been made so that their workstation, in whatever environment that might be, is closer to the toilets? Because for a temporary period, that's a sensible thing to do. So I think all of those kinds of things can be really helpful. If you can't work from home and you want to work from home because you're struggling with the workload, actually, it might be the workload that needs to be adjusted.
Fantastic, thank you. I think we've covered so many different symptoms and the impact that might have on people in all different kinds of job roles today, that hopefully that's created a lot of food for thought, and that it's not just about getting a fan and using a notebook, which is some advice that somebody had been given about how to manage brain fog in their role. So hopefully there's lots of useful tips and different examples of information and how that's worked well across many industries shared today. I'm going to pass back to Zoe now to just close off the webinar for today.
Thanks everyone. Thank you to both Joy and Nicola for joining us today and for your input, and thanks to Liz and Diane as well, and thanks to all of you for participating. I will follow up in a few days with the links to the websites suggested, such as the BSI, and the webinar and all of the other 4 webinars have been recorded, and I'll post the link to our YouTube channel as well, so if you want to rewatch this one or any of the others. And then finally, if you've got any questions, you can email me directly and you'll have my contact details when I send the email out. Thank you.